Hi, I'm Dr. Matt Khan. I'm the founder and CEO of Chiropractic First Group of Clinics. Today I'm tasked to talk about collagen, in particular, Freedom. Freedom has three active major ingredients. Number one is called Fortigel. Fortigel was designed for healing of cartilage. And then the other one has what called Tenderfort. Tenderfort is specifically, again, all three are patented. Tenderfort is designed for the healing of tendons and ligaments. And lastly, we have Fortibone. So what's Fortibone for? From the name, right? It's bone, related to bone. So, why do we need collagen in our human body? Right? Does it disappear by itself? Yes, indeed it does. Right? After a certain age, our body will slow down in the production of collagen. And how old? It started by 20, 30 years old, you start to reduce collagen. And by the time it comes to 50, the rate of collagen loss is quite significant every single year. Freedom comes with a huge number of clinical trials supporting its claims and its efficacy and its quick absorption level. The Freedom absorption is so fast that within 20 minutes, right, upon consuming, it already gets absorbed from the intestine into the blood system. So what does it mean to an individual like you? Means, right, you may find reduction of pain very quickly within 1, 2, 3 days. And that's what we have been hearing from some of our patients. They say that, wow, they've been suffering from it for months and some even years. And upon taking Freedom, within a week, right, they start to move around without pain. And most significantly, we found Freedom to be very helpful for patients that have chronic or have been suffering from osteoarthritis. Of where? Osteoarthritis of the knee. And there are a few clinical trials that, on Freedom has shown that patients with joint problems, because they have joint problems, they cannot function, right? The knee become weak, and the clinical trial shows a major improvement in their strength, right, and return back to function. And that's important for all of us. Again, from clinical trial, within 1 week, collagen for tendon tissue regenerate 1.9 times more compared to when you without Freedom. And for ligaments, right, the improvement even more is 2.4 times more. Does collagen help? So a lot of people think collagen is just collagen. Does it make my bones harder? That means mineralization. Does it help calcium, right, to build into the bone? Yes, it does. The collagen stimulates mineralization of the bone. Your bone mass density will start to improve. Right? And if you do, right, if you go into, right, start to develop into what we call resistant training, you will see your bones start to regenerate and rebuild, right, bone mass. So patients with osteoporosis will find it helpful. What about prevention of osteoporosis? Right? If you are ladies in your 40s, right, even 30s, 40s, 50s, is it good to take this collagen with your supplementation of calcium, vitamin D? Yes, it's significant. Again, clinical trials have shown the difference is 3 times bone mass. So is it significant? Yes, it is. So, who should be taking Freedom? Very obvious. Freedom should be taken by sportsmen, right? That require active function of their joints. General public that walk and sleep and twist their ankle. Weekend players, weekend badminton players, right? Mothers carrying their kids. Very happy to have found this, and in my line as a chiropractor, right, which we deal with musculoskeletal, I find, right, Freedom to be able to complement my work, as well as my group of doctors' work, and I'm quite happy that we have Freedom to assist in our practice. Thank you.